Hey guys, I'm Dr. A. I'm a pediatric allergy and immunologist in Toronto, Canada. I'm also a new mom. I'm excited because I have a little mic thing that I got, and I also bought a ring light. So these are two things I've invested in my social media. Hence, I can make more content for you guys. And it's due to your support. What's up? Topic today is going to be discussing something super important. How do you know and what are the signs that your child has a food allergy? When I'm talking about food allergy today, I'm really referring to anaphylactic food allergy, so life-threatening, severe reactions that are occurring quickly. There is a whole spectrum of different types of allergies, such as calamine protein intolerance, something called FPI. I'm focusing on anaphylaxis today. So in children, we know that the most common symptom is usually skin. So skin would look like hives, redness, swelling, lip swelling. The next common symptoms we see is usually abdominal, so vomiting. Especially in infants, you see that. Then you can see things such as respiratory distress, coughing, wheezing, mostly coughing I see quite a bit. Nasal congestion is also very often seen with kids. Sometimes it gets quite severe where they look blue or they're short of breath. And then the worst case scenario is some type of compromise of their cardiovascular system. So that would look like passing out or losing consciousness, and that's due to having reduced blood flow to your organs due to shock. This is an important distinction because we have a lot of kids that get seen by our allergy clinic where parents are like, oh my gosh, they're having a reaction to food. And then they'll come to the clinic and they'll show pictures of eczema or some dry red rash that's happening hours and hours later in the absence of all the other things I just talked about. So in those cases, it's not usually food allergy and you shouldn't be avoiding a food because of a dry red rash that happened like 8-10 hours later or the next day. So I hope that was helpful. And maybe when now you're introducing your solids, or send this to somebody who is introducing solids so they have something to look at to be like, okay, does my kid have allergies or not? That needs to be seen by a pediatric allergist ASAP.